All right. Well, this is chapter one of our Social Work 225 lecture over chapter one's An Introduction to Community and Public Health by Mackenzie. And so this kind of just introduces the topic of public health and kind of sets the stage for what we'll be learning about for the rest of the semester. I always want to make these videos a little bit shorter than they actually are, so I'm going to move on without further ado. So the chapter objectives, these are kind of what the author of the book feels like we should walk away with after we're done. We're going to define the terms: health, community health, population health, briefly describe the 5 major determinants of health. What actually makes somebody healthy or unhealthy? What is the difference between community health activities and personal health activities? And then list and discuss the factors that influence a community's health. We're going to talk a little bit about the history of community and public health, both majoring in Europe and the United States, but obviously focusing on the United States and how things have changed. We're going to talk about briefly the current health status of Americans, a little bit about healthy people, and the major community and public health problems facing the United States and the world today. So let's talk with some good news. There's been a lot of progress that's been made over the last 100 years in our health and our life expectancy. In fact, I sometimes hear about people who are anti-government, who are just maybe they are libertarian, or they're just like very, very conservative, and they think the government should just be about protecting people's personal property and waging war and things like that. I really feel like if you read chapter 1, you really get a picture of how the government can really help improve the health outcomes for just average everyday people, and you just really see it in the evidence is that we're just living a lot longer. We're a lot healthier. We have a lot more just vibrancy in our lives, and a lot of that is due to the fact that there's a government investment in the everyday person's lives. So anyway, I try to stay away from politics, but I just wanted to put that in there. There's still a lot of room for improvement. A lot of the health outcomes that we've seen are going to a select part of the population, mainly the middle class, and so there's a lot of improvements that need to be made and kind of spread the wealth, so to speak, the health wealth to the rest of the population. So, all right, in terms of bringing good health to the world, it's going to require both individual action, which is actually what I typically think about when I think about, how do we make people healthier? I'm like, well, they need to exercise and they need to start eating more vegetables and things like that. But it's not just that. It's also, we need community action, which is largely what this chapter and book is about. So let's talk about some more good news. What have we achieved in the 20th century, which is the 1900s? I always get a little confused. The 20th century does not refer to the 2000s. It refers to the 1900s, from 1900 to 1999. So a lot of progress in terms of vaccinations, and that means that a lot of the diseases that we were dealing with at the beginning of the 20th century were not. We don't have as many, even the coronavirus, which was a communicable disease, means it was spread from one person to the next. It was largely contained. I mean, I think we've had, about 1 million, probably more than that now, people die from that. But if you compare that to, say, disease outbreaks of the past, this was really small considering our population. So, motor vehicle safety. Cars are so much safer today than they were in the past. Control of infectious diseases, declining number of deaths from heart disease and stroke. We have healthier mothers and babies. The infant mortality rate has gone down dramatically. The maternity death rate has gone down dramatically. We have healthier and safer foods than we did in the past. I remember in the 1980s, I think it was, or early 90s when food manufacturers were now required to put their ingredients and then later on the amount of fat, the amount of cholesterol that was in their products. So our food is healthier and safer. We are more informed about it. Many of us have a lot more choices in terms of what we have access to. Some of that is due to infrastructure. We have more interstates, and you also can order individually off places like Amazon. So you're not merely limited to your whatever grocery store is close by you. So although there are still a lot of what they call food deserts in the United States where people just don't have access to healthier foods. So we have safer workplaces due to things like OSHA and the fact that children are no longer allowed to work in factory settings. We have family planning where more and more people are choosing the number of children that they're going to have and that they're choosing when they are having those. Fluorination of the drinking water is now no longer left up to the individual to choose. If you have public water, it is very likely that it is fluorinated. So that has caused a decrease in the number of cavity and tooth problems that we have. And we recognize today that things like tobacco is a carcinogen. And so while that may seem obvious to you, that was not always obvious. It actually took a long time for us to recognize the fact that tobacco is dangerous for us. It started out, they actually believed it was a health, like a medicinal type of thing when the Indians introduced it to the colonists. So, all right, let's talk about health. Funny picture, I know. Health can mean different things to many people, but I want to challenge you. It's not just the absence of pain or absence of disease in our bodies. It's actually we have this fancy definition here. A dynamic means it's changing, right? And it's multidimensional. It means it's not just in our body, it's also in our relationships and it's in our mind. A resource for living. That means I can take my health and I can use it to work, or I can use it to meet new people and start projects. And it is hard to do that if I don't have health. If my family were to say, let's start a new business, let's build a house, let's do all these things. If I'm not healthy, my ability to do those things is greatly diminished. And it results from a person's interactions with and adaptations to his or her environment. We all live in different environments. There's different water and different food sources and different streets, and our health is going to be based upon how we interact with those different systems given our unique set of genetics and habits and things of that nature. So, all right, let's define community, since this is a community health class. Community health systems class. A group of people who have common characteristics. So what is a community? Well, we can have communities based upon location. So you can say we are Southern Illinoisans, or we are members of a race. So we are a community. We are connected by that, or we're connected based upon our ethnicity. Like we are Jewish, we are Puerto Rican, or we are 50 some odds, or we are teenagers, right? Or we are lawyers, right? Or we may have an interest in some particular problem or some outcome. We may be Democrats, or we may be, I don't know, anarchists, I guess. There's something that kind of binds us together that we would say, all right, we're together in this one, right? Characterized by membership. You are a citizen of the United States. You're a member of your community. You may have common symbol systems where, religion, or, a sport that may have systems of symbols that kind of like that thing is very meaningful to us. Think of like the flag. People are like, they get really, really passionate about that. It's just colors and cloth, but it carries great meaning for them. It represents freedom. It represents patriotism, and people died to defend this idea of America. So There's oftentimes shared values and norms, especially if you go to things like ethnicity or occupation. There's a feeling that we all kind of agree that these things are really important to us. And so when we talk about community health, it's how can we benefit the group of people who are defined by the location, the race, the ethnicity, and so on, given that they are together and they may share a certain belief systems and they may be emotionally connected to one another, so that someone's pain is all of our pain. Sorry. Let's talk about public health. Public health is the actions that society takes collectively to ensure that conditions in which people can be healthy can occur. So if the government does something like build a walking path in your town, that would be an example of a public health, because society is doing that collectively. It's not a private path. It's for everybody. It's using collective money, and you're doing that so that people can be healthier while they walk, because they walk. Community health is there's a little bit of overlap in the definition here, but it's the health status of a defined group of people, right? So if we go back to our previous definition, this a community. So let's say we look at 50-year-olds, which is here, the group of 50-year-olds, what is their health like? And then you can say, okay, well, they have high rates of diabetes, let's say. Well, what can we do about that? Well, we can try to make sure that insulin is available to them, and that we're going to make sure that every 50-year-old, you could, pass a law that says that, 50-year-olds get 2 free consultations from their health insurance provider every year, something like that. And that's going to promote, protect, and preserve their health. So we have different groups, different community groups within the United States that have better health, and other groups that have less health. It's subpar. It's not as good. And so as we try to focus on equality, so that all people have the resource for living, which is health, then we're going to focus on those communities that don't have as good a health. So when I think about health, I oftentimes think about personal health activities. When I were to say, that's just my default. I just think about, okay, you need to sleep better, we need to eat more vegetables, we need to exercise, and stop thinking negative thoughts. Those are all individual actions, though. And those are decisions that individuals make, and they primarily impact the health of the individual, although there is some spillover. And here's how it happens. Let's say that I decide I'm going to eat lots of broccoli. I'm going to go on the broccoli diet, and that's going to benefit me. And so I begin going to my grocery store and I buy lots of broccoli. And so I obviously benefit, but I'm cooking and eating it with my immediate family. And so they may sneak a few pieces here and there, and I may be serving it up more, and maybe I can convince a few of them that this is something that they want to eat as well, right? So it's benefiting me, it's benefiting my family. The grocery store is going to be buying more of it because they're going to see an increasing demand. And so now, rather than the broccoli being all wilty and yellow, now it starts to have green and it's vibrant. And other shoppers, as they're pushing their carts past it, notice, there's the broccoli looks pretty good. Maybe I'll pick up some today. And so they may begin eating more of it, and they may go to a potluck and they may bring some broccoli with them to the potluck, and now they've kind of shared the glory of the broccoli, and so their friends and their family may be influenced as well. So individual actions do impact more than just the individual, but not nearly as much as the community or the public health activities, because these are aimed at improving the health of the entire population or community, or at least a large portion of it. You're never going to get everybody. By the way, sometimes people are against community and public action because they're like, well, you're never going to get everybody to go and eat healthy or stop smoking or whatever. And that's kind of a weak argument because, yeah, of course you're not, but you can increase the benefit for a lot of people, And so anyway, don't be deterred by that sort of argument. So these are activities that are aimed at the larger group, and so these are going to include things like birth and death records. And why would you want to know those sort of things? Well, you want to know them because you want to know what people are dying from, and you also want to know who's in your community. Do you have a lot of young people? Do you have a few young people? Are people dying of cancer, or are they dying of pneumonia? And you can then direct your efforts toward the things that are going to have the most impact. You can protect the food supply and the water supply. If let's say your water has a high levels of, I don't know, mercury or fecal matter, you could say to people, well, hey, as an individual action, you should be drinking bottled water, right? Because hey, the stuff that was coming out of the tap is not very good. But, the reality is the only people that most people who can do that are probably middle class and there are some people who are just not going to do that at all. And so rather than making people go out of their way to buy bottled water, which, by the way, is typically not healthier than what comes out of the tap, it's much less, it's not as regulated as the stuff that does come out of the tap. Let's just do something that's going to impact everybody, right? And much cheaper, and it's create less waste, and it's just more of a positive thing. All right. Well, let's talk about the factors that affect the health of a community. So when you think about this gentleman here, and you think about what makes him healthy or unhealthy, again, the first thing that pops into my head are his behavior choices. How much sleep does he get? Does he smoke? Does he exercise? Does he eat his vegetables? Or that sort of thing. Does he tan? But there's 5 other things that also impact him, and maybe more so than his individual behavioral health choices, but I don't know. Anyway, I like behavioral choices because those are the things we have the most control over, right? Like we have basically no control over our genetics, but here's what we do have control. We have control as to whether those genetic weaknesses or strengths are activated. So for instance, if I have the genetics of an alcoholic, I do have some control over whether I become an alcoholic based upon how much I drink. Or if I have the genetic weakness of heart disease, I can do things that we're going to reduce the odds that those genetic switches will be flipped. And there are even some controversial ideas of epigenetics, which is what causes some things to be turned on or turned off, but I'm not going to go into those. By the way, I'm not a doctor. I should say that from the beginning, so I'm not giving medical advice here. Let's look at his medical care. Does he have access to a doctor? Does he go to his doctor? Does he listen to his doctor? If he had a health emergency, is there an emergency room that is close by, or is it far away? If he has substance abuse issues, can he afford treatment for that, or is he without that? Social circumstances. This is things like, does he have health insurance? Does he have money? Does he have friends that say, run marathons on the weekends? Or does he have friends that, sit around and drink beer on the weekends? Because those are going to have impact on his health as well. And then the other thing is environmental conditions. And this is a lot of different things. This is, how healthy is the water that comes out of his tap? How healthy is the air that he's breathing? Is the house that he's living in, does it have, formaldehyde? Does it have lots of toxins in it? Is the food that he's eating, is it have lots of pesticides and such? It also is things like if he lives near a busy street with lots of honking horns and things like that's going to be stressful. Are there lots of liquor stores near him, or are there paths where people are always biking and having picnics with scenic water next to him? So, all right, let's talk about the factors that impact a community's health. If we've talked about the individuals, we can talk about the communities here. And I think I have slides. No, I don't. The physical factors that impact someone's health here. are things like the physical location that it is located in. And this is going to include things like the environment. Sorry, the physical factors are include things like, we'll start with geography. The soil that is in the area. And so the soil is where much of our food is grown, and even if we're feeding that food to animals and then eating those animals, it's still going to have a trickle up effect or trickle down effect. The temperature where the community is located, is it very hot all year round, and that's going to allow the bacteria and the fungi and the bugs to not die off during the winter. Or is it, it very cold where there's not as much, say, vitamin D in the environment because there's not much sun there. Let's see, social and cultural factors. So these are going to include things like beliefs and traditions, prejudices around health behaviors. And so, in some small communities, there's the belief that anyone associated with, say, the government, and especially around health, this would include people like, who's the Italian guy, Dr. Fauci, that all those people are quacks and they are just, selling us a bill of goods, and they can basically be ignored carte blanche. And so, because we had an uncle, Jerry, who lived to be 99 and smoked and drank every day of his life, and so that belief obviously sets people up for a lot more health problems than the belief that, that doctors, while they're not miracle workers or gods, they do have an understanding of health that is likely much greater than ours. And places like the CDC and Surgeon General, they do a lot of research. And so that is going to translate to a much greater understanding than we might have had otherwise. And so, we all have to make the decisions for ourselves, but taking those people seriously and those organizations seriously is going to benefit a community, right? On the other hand, if there are traditions such as every Sunday we get together and we eat fried chicken, with lots of butter and biscuits, then that is, setting us up for some problems that are related to heart disease and obesity and things of that nature. So this social and cultural factors are also going to include things that are related to the economy, politics, religion. So we're going to move on here and talk about the environment. This is going to include things like the air. This is going to you can look at specific things like if you're in a big city like Chicago or New York where there's lots of buildings and they're very close, then you're going to have more smog and more toxins per square foot. Yeah. And community size. So community size is a two-edged sword, like most things are. The larger communities are going to have more doctors per person. So if you were to go to, say, St. Louis, this is made up, there's one doctor for every 1,000 people, whereas in a rural area, there's one doctor for every 1,500 people. And there are also going to be more specialists. So if you have a specific disorder, that you may have to travel far away, and so people are less likely to travel far, for things because traveling as far is difficult. So industrial development, again, is a two-edged sword because, industry brings jobs and health insurance and money to spend on health, but it also brings more toxins to the environment. So, okay, I mentioned those already. Let's talk about community organizing. This is, I think, one of the most interesting ideas. So there are some communities which are going to be impacted by things like an opioid epidemic, and they're going to improve the health of that community, and other communities are going to be overwhelmed by it. And so community organizing is a process by which communities are helped to identify common problems or goals. They're going to mobilize resources, but realize that this is a community effort. So the community identifies the problems and the goals. The community mobilizes the resources. We're going to get, the mayor involved. We're going to get the doctor involved. We're going to get the gym teacher. And they're going to develop and implement a strategy for reaching the goals that they have collectively set. It is not so much top down, it's more bottom up. It's not the great man or woman at the top running the show telling everyone else what to do. That might work in some places, but in America, we're pretty independent, and we're kind of reluctant to invest our time and energy in someone else's goals. And so this is not scientific as much as an art form of building consensus, which means it is difficult from an expert from the outside of the community, to come in and get the community to pay attention and buy into the outsider's ideas. But I just love the idea that the community would say, together we are strong, and divided we are weak. And so if we want to take the health of our community seriously, we have the power to do that if we so choose. So let's talk about the history of community health. Here, I'm always going so much longer than I want to. The history really sets us up for the future, as you'll see a lot of issues that are happening today that have been going on for a long time, and the patterns continue as well. So obviously, we've been doing community health practices for a long time. If you look at ancient religions and the texts of those, it's often related to things around health. This would be food, cleanliness, sexuality, mold, things of that nature. All right, but we're going to skip way ahead to the 18th century, and we are going to look at what happens in the 1700s. Okay, so the 1700s are characterized by a lot of industrial growth, a lot of movement from the farms to the factories. The factories are located in cities, which obviously become very overcrowded and overgrown very quickly. They're not able to build out the infrastructure, the water supplies, the waste systems, and so you have a lot of problems with cleanliness, and there are not very many worker safety laws at that point. And in fact, oftentimes the government actually works against the safety of workers in much of the time in the beginning of this industrialization. But in the 1700s, there is a first census taken where now the community knows the ages and who is in the community. So that allows the people in power to be able to make decisions based upon that data. So in 1796, Dr. Jenner demonstrates the process of vaccination against smallpox. Smallpox is a real issue in the 1700s and before that as well. And there would be epidemics, and many, many people would die. I think it's interesting. I included this picture of Lady Mary Wortley. She is the wife of a diplomat to Istanbul, and in the early 1700s, she goes to Istanbul and discovers that Istanbul is in modern day Turkey. They have very low levels of smallpox, and she investigates and discovers that they are doing something called variolation, if I'm saying that correctly. And basically what it is that they are taking a needle and somebody who has smallpox, but maybe a weak version of it, like a small case of smallpox, and they're taking a needle and they're rubbing it through the blister, and then they're putting it on a child, and they're scratching, or if they find like a cut, they're kind of like putting the needle there to give the child a small dose to create immunity. And so she's like, wow, this is amazing, everybody should know this, and then tries to convince the British to do this, and they don't go for it. Some of them look at her and say, you're a woman, so what do you know about health? Others look at her and say, you got this from the Muslims, so what do they know? Others look at the fact that she was able to convince the royal family to do it, and many of them were very against the royal family, probably for good reasons, but they don't do it because the royal family does it. So we saw some of those same things here a couple years ago. All right, the second half of the 19th century. There's epidemics in major cities. There's cholera epidemics. And Dr. John Snow has this theory that there's something in the water that is causing the cholera. And he advocates we need to turn off this water pump. And they don't like the idea, but eventually they do it, and it stops the cholera epidemic. And this is really impressive because they didn't understand very much about how diseases were spread. I mean, you couldn't see anything because it was a microscopic organism, and but he had it right and was able to save lives. So there are a lot of scientific discoveries during this point in biology and chemistry, and it's part of the reasons why we are having, or they had, the Industrial Revolution. And so they're beginning to understand these things about health. Realize that previous to these scientific understandings, there was a belief that people got sick because of miasmas, which is kind of like a mist, or there's curses, or like bacteria that can shapeshift and cause smallpox for one person and cholera for another. In the United States, 1850, Lemuel Shattuck creates a report advising the city of Boston that it should do more to help the community health, doing things like doing things like census reports where they know the ages and the deaths of who is in their community, and doing more advocacy and public education. And so it kind of just introduces this idea that communities can take active roles in promoting the health of their people. So this is kind of the birth of the modern era of public health. So, moving on. Realize that in the 20th century, which is the 1900s, our life expectancy is still less than 50 years old. Aren't you glad that you were born today, where we get the expectation of being in the late 70s is life expectancy when we are born. The leading causes of death are communicable diseases. That means that they're diseases that are coming from the outside of us, coming into us. So whether that's smallpox, or the flu, and if we have deficiencies in our bodies, whether vitamins, minerals, then we are going to be a easier target for these communicable diseases. So in the places where there are lots of poverty and people are very close together, like in the slums of New York and Boston and Philadelphia, you have a lot more of that. So, all right. But there is positive change occurring during this time. Looking from the 1900s to 1960s, you have a lot of healthcare facilities that are being built, and there's more providers that are available. And if we were to look specifically at the earliest part of the 1900s, 1900 1920, you have the growth in the number of clinics that are being built here. You have a lot of people who are coming from Europe, and they are moving into the urban areas, and you see this explosion in the number of people who are living in urban areas compared to the rural areas. There's an awareness of factory work by the public. Upton Sinclair produces his book, which kind of shines a light on factory and food production. There is the U.S. Public Health Service is created. John Hopkins creates the first school of public health, and then moving on to the Great Depression, there's an awareness that the larger governmental systems are needed to preserve people's well-being. We've always been kind of a country that believes that people's welfare and their kind of destiny is in their own hands. But during the Great Depression, that really comes down a bit, because you could work hard and doing things right, but you still may lose your job and then your home because of larger issues that are going on in the economy that have nothing to do with you. So people's perspective shifts, which allows Roosevelt to spend a lot of money on public health to control things like malaria, building hospitals, and creating water systems. And then also things like the Social Security Act in 1935, which creates a safety net for the elderly and the disabled. During World War II, they discovered penicillin, which allows us to treat infections. So, all right, moving on. The period of social engineering from 1960 to 1973, the post-war era, which is like right after World War II ends, up until the 1960s, is a pretty prosperous time. In fact, if you ask a lot of people, like, when were the good old days, they probably have a picture in their head of like an Ozzie and Harriet or something from the 1950s. It's because there's a lot of stability, times were good, people have a lot of babies, and there's a lot of growth, and we build the suburbs, and suddenly housing becomes way more affordable for a lot more people. But they discovered in the 1960s that a lot of those benefits didn't spread to poor people, it didn't spread to people of color, and so they try to kind of spread the wealth, so to speak. And so that includes things like community health. And so the federal government becomes more active in health matters. In 1965, we create Medicare and Medicaid, which are large governmental health insurance policies. And in fact, a lot of federal government money today, I think it's about a third, goes to Medicare. There's increased standards for health facilities, and the rate of spending on healthcare really kind of takes off. And this is, in some ways, this is good, in some ways this is bad, because healthcare is really expensive today. In the 1970s, they discover that about half of premature deaths are not due to accidents or just bad luck, but actually due to things that we're choosing to do, lifestyle choices, behaviors. And so there's an emphasis on getting people to behave in a different way, whether that's eat different or exercise, things, drink a little less, things like that. So, Healthy People, the publication that sets out the goals and priorities for research, for public health programs, is created during this time. And then every 10 years they have a new Healthy People. I remember Healthy People 2010, and then there's Healthy People 2020, and now we're obviously on a new one for that. And so what's going on in the 21st century? Well, we have some problems with healthcare delivery. We have a lot of people who cannot afford to go to the doctor. I got a chart there, and forget the numbers, but just look at the amount of spending that we're doing in 1960s as compared to what we're doing in 2020. So the cost of healthcare has just gone through the roof. So we have environmental problems where the air and the water quality, especially in certain communities, and like most things, it typically happens to people who are poor and then young and then the very old. Those are the groups that are typically impacted by the environmental problems. Today, most people are dying because of lifestyle-related disease, diabetes, heart disease, cancer, that are oftentimes traceable back to smoking, alcohol use, stress, things of that nature. We still have communicable diseases like COVID-19, or I guess not COVID-19 anymore, but the coronavirus, AIDS, things of that nature. Alcohol and drug abuse are still a problem, and especially increasingly among people who are poor and rural. And I read something the other day where you have an increasing number of younger people, especially among the uneducated, who don't have maybe a positive outlook for their future. They're not college bound. They don't see the fact that their life is going to be better than their parents. They're turning to opioids, perhaps as a coping mechanism. So, health disparities. We have some segments of the population, maybe in urban and suburban areas, who are doing well. their health is good. They're living into their 80s, and then you have people of color in rural and poor individuals who have a lot more problems. So, increasing numbers of disasters. It seems like every year California sets a new record for fires, and they're not just impacting Californians, but the smoke and ash from those is impacting even New York City. And so coronavirus really has shone the spotlight on the fact that we are not ready for public health emergencies on epidemic levels. We didn't even have enough masks to go around for healthcare professionals. So people were making their own masks, and so preparation for public health emergencies. So, looking at the world real fast, there's a lot more communicable diseases in the poorer areas of the world than there are in the richer areas. There's more communicable diseases in places that are warm year-round. There's still a lot of problems with poor sanitation and unsafe drinking water. Issues around hunger. This is being recorded in 2020, and there's a lot of concern that due to the war in Ukraine, that there's going to be not enough food for many of the poorer countries because they were used to getting wheat from Ukraine or from Russia, and those they're not going to be available to them. The UN predicts that you're going to see a lot more migration in the next coming decades than we've seen in the past, and that presents a health potentially crisis for those people. It is difficult. If you're running away from your government due to persecution, you're not going to have time to prepare yourself for the road very well and in order to remain healthy. And so this is going to be an issue for an increasing number of people, especially as global warming it appears to be impacting the climates, which seems to be impacting political stability. So, all right, the 21st century global health achievements. Let's look at some positive news before I finish. We have a reduction in child mortality. You have a lot more children growing up, right, which actually causes people to have less children. Right? We have a reduction in vaccine preventable deaths. We have a lot more people who have access to safe water and sanitation, malaria prevention, HIV and AIDS, which was feared to kind of consume the world, has been brought under control. Tobacco control, you have a lot less people smoking today than you did 50, 60 years ago. The roads are a lot safer than they were. We have systems to prepare and respond to things. I don't think they're adequate for what we are facing and going to face, but at least they're better than they were in the past. And then the control of neglected and tropical diseases such as malaria. So, all right, we're going to skip the discussion questions because this has already gone on longer than I wanted it to. So, but that is chapter 1.